Here we have the heart failure. In heart failure, there are two types: systolic and diastolic. Systolic is the outflow, decreased outflow, and diastolic is the decreased filling failure. And systolic, we have the right and left. In the right, we will usually gain signs, and left we have the symptoms. Diastolic, decreased filling failure. And there are hypertrophic cardiomyopathy, constrictive cardiomyopathy, and restrictive cardiomyopathy. Now we are going towards congestive heart failure. All diabetic 35 years present with shortness of breath, orthopnea, and shortness of breath. His pulse is 100, blood pressure is 160 by 100, has petty radius 24, temperature 95, pedal edema, GVP is raised, basal crackles due to edema, pulmonary edema, and there is apex result display S3 audible on auscultation. Then there is features of right ventricular failure. Here the general consideration: body pump blood to the right atrium, and the right ventricle pump blood to the lungs. The lungs pump blood to the left atrium. Left ventricles pumps blood to the body. And if there is a right ventricle failure, then there's lots of fluid everywhere. In right ventricle failure, the GVP is raised, hepatic edema, hepatosplenomegaly, ascites, hepatojugular reflex. In left ventricular failure, there is dyspnea, orthopnea, PND, GVP, hepatic edema, cardiomegaly, atrial pleural effusion, crepitations, due to pulmonary edema. If there is left ventricular failure, if the right ventricular failure, the reduction in ventricular output. The most common cause is chronic lung disease, pulmonary embolism, pulmonary valvular stenosis. In called pulmonary is right heart failure with respect to the secondary to chronic lung disease. If there is left ventricular failure, a reduction in left ventricular output, increase in atrial and pulmonary venous pressure. If it is sudden, then it leads to pulmonary edema. If it is gradual, it will lead to pulmonary hypertension. Causes of heart failure: the ventricular dysfunction, high output failure, then valvular disease, arrhythmias, volume overload, ventricular volume overload, ventricular inflow obstruction, ventricular outflow obstruction, reduced ventricular contractility. And then there is precipitating and aggravating factors in MI, arrhythmias, and beta blockers, NSAIDs, and glucocorticoid, pulmonary embolism, and increased metabolic demand, pregnancy, thyroidoxicosis, anemia, intravenous fluid overload. Clinical features are symptom dyspnea, orthopnea, PND, nocturnal curve diaphoresis, and sign JVP elevated, gallop rhythm, S3, new systolic murmur, expiratory wheeze, lung rapidation, petting edema. These are the features of left-sided heart failure. The features of right-side heart failure is petting edema, JVP raised, hepatosplenomegaly, hepatojugular reflex, ascites, left right ventricular heave due to pulmonary hypertension. Left side heart failure lead to right side heart failure. Complication is renal failure, hyperkalemia, hyponatremia, liver function, thromboembolism, ET ventricular arrhythmias. And then there is NYHA classification: no limitation of physical activity, slight limitation, marked limitation, and able to carry any physical activity. Investigation will do chest X-ray and echocardiography is the initial test of choice, and raised BNP is the highly diagnostic and prognostic. ECG, cardiac catheterization, blood examination, management management of heart failure, acute heart failure. In acute heart failure, with pulmonary edema is a medical emergency. How we treat pulmonary edema: sit up the patient, give oxygen, CPAP, nitrates, and loop diuretics. Management of chronic heart failure: in chronic heart failure, we do general measures and drug treatments. We do diuretics, ASARBs, neprilysin inhibitor, vasodilator, arterial dilator, ivabradine, digoxin, and imidron. And non-pharmacological: cardiac defibrillator, cardiac resynchronization, coronary revascularization, cardiac transplantation, and ventricular assist device.